Before we get started, I just wanted to make sure that we put out a disclaimer that this video or anything said on this video is for informational purposes only, and it's not intended to make any claims on any cure or prevention or treatments on any conditions. So please do seek your medical professional, and we'll get started right now. So Dr. Mariam, we're talking about pain.
Yes.
And the pain connection.
Yes.
I love this topic because so many people, so many of us have pain. There is at least 80% of the population that suffers from pain at some point in their lifetime. And we're not just talking about acute pain, which could be from an injury. We're talking about chronic pain. So chronic pain, unfortunately, is one of those things. In some cases, I guess acute pain when it comes for surgical, post-surgical, that many are prescribed medications and they get stuck or they get addicted to these medications, and it's very, very hard to get off of them. And so we want to really get to the root cause of pain. Oftentimes I look at pain as a signal, as a alert sign saying, hey, be careful, there's something out of balance, let's get to the root of this pain versus just suppressing it. Too often, you know, we are driving down the street and we get to a yellow light, and this yellow light is flashing and we just run through it versus saying, hey, it's caution, let's stop and look to see what's going on. And to me, pain is that yellow light saying, hey, caution, let's take a look before we just suppress it with some kind of a medication. Because when we do that, suppress the pain, then at some point that pain still needs to get out. It needs to manifest itself somehow. So if you're having headaches, the headaches may go away, but then you might start getting abdominal pain, or you might start getting back pain, and it really hasn't resolved itself. It's just moved from one block to opening to a door that may be open.
So I am just in the midst of trying to get into the Facebook situation so that we can get on there too, but I do want to just say that this is also a topic that is really near and dear to my heart for a couple reasons. The first being that there were 67,367 overdose deaths in the United States in 2018, and those are largely from opiates. And then NSAIDs or anti-inflammatory medications are actually also the 15th leading cause of death in the United States. So this is a really major issue. When I was very young, a family friend of mine actually overdosed and died. So at a very young age, I was witness to and sort of aware of how big of a problem the opiate crisis is in the United States. And since then, it's only gotten worse. So that's one of the reasons I really like this topic. And I think it's really important to approach it from naturopathic perspectives. And the second reason is that because I also experienced pain at a time in my life, and that's actually what brought me to naturopathic medicine eventually, is that I was dissatisfied with sort of the solutions that I was finding, the information that I was being given by conventional medicine. And so I started to do my own research, and in that process became aware of naturopathic medicine, and actually I became Dr. Darvish's patient many years ago, and I was able to get out of pain. And so I do think that this is a really important topic that naturopaths are more than adequate at addressing.
It is. I mean, that's one of our specialties, right, is pain management, but really not just pain management, is to get the body to heal. So the trauma that you faced, having a friend overdose, that in itself can become a source of our physical pain, right? Many times we forget about the emotional traumas and we kind of block it out, but our body does not forget. And so it manifests it in some kind of pain, whether it's in your low back or abdomen or headaches or neck pain or what have you. And it takes time to go through all of that trauma that we've kind of collected over years within our system. And it doesn't need to be as intense as what you felt. It could be very minor, like a minor car accident, but enough of a shock where the body memorizes that trauma, the physical trauma, but also the emotional trauma with that pain. So it is a very, very important topic to discuss. I see the pain as multifactorial. It's, the sensation of pain is often objective or subjective, I should say. And we think it should be objective, but it really is subjective. Because when we have done in the studies and the research, when there's been patients who have had severe back pain, let's say, and they've looked at CT scans or MRI, they may not see much. They may not see a herniated disc, or they may not see any impingement of the nerve, yet this individual is in extreme excruciating pain. And then on the other hand, there's been cases where patients have really horrible looking backs on imaging, right? They've got herniated disc and impingement here and there, and there's no pain, right? So pain is in some ways very subjective because we carry so much there. There can be toxins from infections that may be there. There could be emotions like we talked about just a few minutes that could be hanging out there. It could be coming from the gut imbalance, like we discussed last week about the dysbiosis and causing this inflammatory response that travels up to the brain and signals pain. It could be hormonal, as many of us females and men get to know as they get older, as they lose their testosterone, that they start feeling more pain. And it's because these hormones do play a huge role in the way pain is manifested and controlled and inflammation is controlled. And that's something we'll talk about next week on our hormone live time. So there's hormones, there's injuries that cause pain, of course. There is fascia. I want to talk about a little bit about fascia. I know Dr. Marian has done some research on the whole microscopic version of fascia. It would be great to hear what you have found in your research, Doc.
Yeah, absolutely. I used to do research at Benaroya Research Institute, which is a research institute that's part of Virginia Mason that looks at autoimmune diseases. But our lab was actually it was named the Hope Heart Matrix Biology Lab. So it was 100% entirely focused on the extracellular matrix, so on the fascia and the connective tissue. Our individual research project was actually on Hutchinson-Gilford progeria syndrome, which in short is known as progeria. People usually think of Benjamin Button, but it's actually where children have a disorder of accelerated aging, and they usually die of old age diseases, heart attack, aneurysm, stroke by the age of about 15. And they visibly look aged. They look like they're about 70, 80 years old by the time that they're 11, 12 years old. So it's a really interesting disorder to look at aging and also to look at the extracellular matrix, because the reason that it occurs in children is due to a single point mutation in a protein called lamin A. And lamin A is a nuclear scaffolding protein, which just means basically it holds it in the nucleus, or holds the nucleus in place and connects with the extracellular matrix and communicates to the extracellular matrix through proteoglycan, basically fascia. And so the single point mutation, just a single nucleotide that is misplaced and is in error, causes this rapid aging and then subsequent death in children. So it's a really fascinating condition. But the lab as a whole looked at a lot of the hyaluronan types, type 1, type 2, and type 3, a lot of the factors that contribute to dysfunctional extracellular matrix and an inability of the matrix to communicate. And one of the things that they looked at particularly was the communication functionality of the matrix, whereas before we sort of thought that it was just structural, that just holds things in place and keeps your organ here and not over there, but actually it is functioning as intracellular communication. So it's a really interesting and new field in medicine.
It's absolutely fascinating, the whole matrix concept, because the way I see it is the space in between the cells, right? Mm-hmm. And it's open. And that open space actually becomes part of the environment around us. And that's how we're really linked to the environment around us. That's why, you know, some toxins in the environment can actually penetrate our system, not just through our sense of smell and mouth and this and that, but actually through the matrix. It's a very fascinating system in our body. And oftentimes we don't talk much about it. It gets missed.
Yep.
Right? Especially when it comes to pain, because when injuries happen, and this could be a birth injury, it could have been a sprained ankle, it could have been a car accident, it could have been a surgical injury, but all of these injuries leave a scar, whether it's an external scar or whether it's an internal scar. And these scars kind of become like a roadblock. Mm-hmm. That's the way I like to explain it to my patients, is that it's a roadblock. And if you think about a roadblock, the roadblock doesn't allow traffic to move through on the other side. It slows down the traffic and it builds congestion on the other side of the roadblock. And that's what happens to us, is when we have a scar tissue, whether it's internal or external, and it can be very, very superficial, like a skin scar from a mole removal, but it's creating a block to the nervous system, to the lymphatic flow, to the circulation, and it's not allowing the energy to move through to help the area beyond that heal. And at the same time, the scar is very sticky and gluey, and it grows bigger and bigger and bigger over time. And so it kind of acts to pull on that fascia, right? So the fascia is like that connective tissue, that tablecloth over the table that covers everywhere in our body, all the organs, keeps the organs in place, keeps the skin in place, keeps the nerves and the blood vessels. In fact, the lymphatic system, the blood vessels, and the nerves grow out of that fascia. So it's a very intricate part of our whole system. And that is a system that starts depleting and degenerating over time as we age. And that's one of the reasons why we have more pain and aches as we get older, is because the matrix, the fascia involved in that, gets dehydrated and starts breaking down. And so we feel more pain as a result.
Yep.
So I love talking about this stuff.
Yeah, me too. So I'd like to actually maybe just get into, pain is sort of an elusive concept. So what exactly is pain? What the heck is pain? What's going on in the body? And actually, pain is actually three quite different things that physicians commonly fail to make that distinction, but naturopaths are definitely a little bit more tuned into the nuances of pain. But the first type is actually an early morning physiological protective system. So this is what's happening when you touch something that is too hot or too cold or sharp. You get nociceptive pain, and that's concerned with sensing noxious stimuli, so harmful or dangerous stimuli. And then the second type of pain is actually adaptive or protective, and it heightens sensory sensitivity after unavoidable tissue damage. This is inflammatory pain. And that assists in healing of the injured body part by creating a sensation that discourages physical contact and movement. So if you injure a knee, you're going to have pain to try, your body is wanting you to slow down and let it heal. And then the third type of pain is maladaptive, and I really think that this is actually where naturopathic medicine and conventional medicine diverge, and it's a really important point to think about. But conventionally, when they think about maladaptive pain, this is pain that is not protective. and it results from an abnormal functioning of the nervous system. It's known as pathological pain. And this is not a symptom of a disorder, but rather a disease state of the nervous system, according to conventional medicine. And it can occur after damage to the nervous system, as in with neuropathic pain, but is also in conditions where there's so much damage or inflammation that there's dysfunctional pain. You can think about fibromyalgia, IBS, tension type headache, TMJ, interstitial cystitis, and other syndromes where there exists substantial pain but no noxious stimuli or minimal or peripheral inflammatory pathology. So basically they can't find a reason for the pain. And then I would say that naturopathic medicine, naturopathic doctors will often find a reason for the pain and will actually look a little bit more outside the box and outside the limited realm of perspective and say, no, there actually is an infection, or there's a heavy metal, or there's a food sensitivity, or something of that sort that is creating this pain. So your body isn't really just creating fibromyalgia. We are truly perfect and whole individuals. It doesn't just create chaos and dysfunction for no reason. Something is usually the trigger, and addressing that trigger and getting the body to calm down from the chaos storm will help to relieve that pain. And it's not just a mystery. You just need a good detective.
Yeah, we just have to be detectives. And I think that's one of the things that I enjoy doing, is figuring things out and figuring out where is that pain coming from. And it can be multidimensional, right? It could be layers, one layer after the other. And oftentimes we think, okay, well, we turned on the switch, the pain should go away. But there may be other things that are hidden in that area that we're holding on to for generations, for years, that we're not aware of. And so that it creates this pull on that fascia or the nerves or what have you, creating the sensation of pain. The interesting also part of pain, or all of this, is that there is a huge interaction with the nervous system and the emotions. Again, right? Mm-hmm. That there is a communication that goes on in the fascia, in the nervous system, to the brain, signaling emotional shifts that happen with that pain, and vice versa. So we can actually shift pain by the way we think, and by some meditative or imagery or visualization techniques, by using acupuncture in different parts of the body to release the toxic buildup that has been collected in that area. One of my favorite tools is neural therapy. Mm-hmm. For some of you that don't know what neural therapy is, it's basically a European-based injection technique that uses procaine, which is what I call a nutritive anesthetic. In other words, it pumps the blood vessels, it gets circulation into the area and pulls the toxins out. And as it does that, it breaks up that scar tissue, it resets the nervous system, it corrects the signaling that is going to our brain and back and saying, hey, there is pain. It reduces that. So that's one of my favorite treatments, is this technique called neural therapy. And we see incredible results with it, with patients where they're having limited range of motion with their shoulder, maybe even capsulitis or shoulder rotator cuff issues, and they can't move that shoulder. And you start doing these very, very superficial injection techniques around that shoulder. And sometimes it's not the shoulder. Maybe it's your low back. I inject the back and the shoulder releases. Or we inject the scar that's down in your leg and that shoulder releases. And it's because, again, this whole fascia thing that's all connected, and our body is really this beautiful whole thing, like you were saying, Dr. Marian. It's all connected. It has the capacity to heal. We just need to get out of the way and give the body what it needs.
Yes, yes. Yeah, a couple of things I really agree with. The point that acupuncture can help with the clearing of emotions. Chinese medicine has a beautiful way of incorporating emotions into medicine without it being weird. For example, the lungs are where we hold grief, the kidneys are where we hold fear, the gallbladder is where we hold indecisiveness, and so forth. And you go to a medical doctor or Western medicine perspective, and that's sort of woo-woo or weird, whereas with Chinese medicine, that is normal. That is just standard medicine. And so if you're considering that the person is struggling with grief, you're absolutely going to look at lung health, and acupuncture can be really helpful in that moment-to-moment clearing of emotional stress. So I think that's a beautiful approach for the emotional piece to pain. And then as far as neural therapy goes, I love neural therapy too. I use it so much. There's really interesting physiology effects of it. For example, it's metabolized to para-aminobenzoic acid in the body, which is PABA. PABA is actually available over the counter. It's anti-fibrotic, so it's perfectly safe in the body, whereas lidocaine, also a local anesthetic, is actually a carcinogen. So we use procaine, metabolizes to PABA. It's anti-fibrotic, so it takes that really disorganized, mangled scar tissue that is not laying flat, that's very sticky, it's very hydrophobic and allows toxins to stick there, and it basically relaxes them, and it dissolves some of that scar tissue and lets it lay down flat like an organized extracellular matrix, as it should be, and then the cells around it can communicate more appropriately, and any nerves in that area that are hyperexcitable, that are closer to their threshold, actually become more normal, which is a minus 70 millivolt resting membrane potential, and they're less hyperexcitable, so the person may experience less pain, their digestion may improve, they may start sweating in a place that they didn't sweat before. So there's a lot of really, really profound effects from a very simple and more or less painless injection. Pretty simple procedure with a lot of profound effects.
It is. I mean, sometimes we see this whole emotional release.
Yes.
After you
I've
inject
seen that.
Right? It's amazing what people carry in their scars. And we're talking about any scars, like tonsillectomy, if you've had your tonsils removed, or your appendix removed, or you've had any kind of aesthetic form of surgeries. Any kind of surgery will create these scar tissues, and these scar tissues will become a source of an area where toxins can hang out in there. So toxins from infections called biotoxins can hang out in there. We've got inflammatory toxins, cytokines increase in that area. We've got chemicals and heavy metals, mold toxins. A lot of toxins can collect in the areas where the scar tissue is. And sometimes we find that people don't get better, whether it's from pain or whether it's their chronic condition or blood sugar or what have you, unless they get those scars treated. In fact, I remember a patient of mine who was about 16 years of age, and she came in, her abdomen from almost the day she was born was full of surgical scars. I mean, she had surgeries from the moment she was born. We started doing neural therapy. She had a history of depression and anxiety and actually psychosis, and had ended up in Children's Hospital for 2 months. She was from Alaska. And when she came to see me, we decided that the scar tissue on her abdomen was the big deal. And so we started treating this with neural therapy, and her psychosis and depression and anxiety all went away. And in fact, a year or two later, she had an appendicitis attack, and she went to the emergency room, and the emergency room doctors say, well, you know what, if we open you up, you've got so many surgical scars here, if we open you up, we're probably not going to see anything because it's all going to be scarred. Wow. Well, they went and took a chance and opened her up, and there was no scars. All the scars had healed from the neural therapy. All the adhesions had resolved from the neural therapy. So it's something to really think about for each one of us, because we all have had some kind of an injury or surgery of some sort throughout our lives. But manipulation, so, we find that patients get back pain, neck pain, and they get manipulation. We do that here as well, the osteopathic manipulation, very similar to the chiropractic manipulation. But what I find is that when you're manipulating the bones, we're just trying to realign them again, that if the fascia, if the muscles around them, if the nervous system, if the toxins are not addressed, the bone keeps going out of place, like the joints keep going out of place. And that is one of the reasons that you find the chiropractors have you come in 2 or 3 times a week, It's because it's not really addressing the root of it. They're just trying to reteach this thing to hold into place. Whereas if we find what the block is, it could be a nutrition deficiency, like magnesium deficiency, right? If we give you magnesium or get your body to methylate and detoxify, then that nervous system frees up, the toxins release, and the nervous system doesn't need to hold itself so tight in that low back or mid back or neck. And so when you do get the manipulation to realign you, you stay good for weeks, months, because you've treated now more of the root versus just symptomatically trying to address the pain.
Yes, yeah, definitely.
I know you had some other things that you wanted to talk about, Dr. Marion. Do you remember what those were?
Yeah, definitely. Well, just actually primarily the first thing I want to mention is that naturopaths follow really pretty basic principles, 6 principles. And the third one is identify and treat the cause. So we are often looking for the root underlying cause like we've been talking about. We don't use something like cortisone to inject and just smother or to put out inflammation. We're looking for where that fire is coming from. And so I really wanted to make that point. But there's lots of really beautiful herbs that we use for pain, and it depends on if we're trying to get an analgesic or pain reducing effect or an anti-inflammatory effect. Or if we're actually trying to remove some of the waste, so alterative herbs actually are trying to get some of the garbage in the connective tissue out if that's contributing to the pain. So there's a lot of different really wonderful herbs, boswellia, myrrh, corydalis, which is a Chinese medicine herb, capsicum, harpagophyta, which is devil's club. And then I think that one of the really most powerful herbs is cannabis, and of course, it's so widely available now that I think it can be misused, or it could be used more efficiently depending on how and what the person is using it for. And so when you're talking about cannabis, there's actually 25% fewer opioid overdose deaths in the United States since medical marijuana was approved, and that was published in 2014. It's very safe in terms of toxicity. And the endocannabinoid system is a system in the body all to itself. This is an entire messenger and molecule system in the body that controls pain and inflammation and hormones. And there's receptors for the endocannabinoid system that are not present in the brainstem or the respiratory system, so that it won't suppress cardiovascular or respiratory system function. And that's why it's safe to use alongside opiates. And CBD affects many biochemical pathways. It's anxiolytic, antipsychotic, epileptic, antispasmodic, and it's helpful for pain and inflammation. So it's a really powerful thing, but I don't think it's something that should just be used without some scientific knowledge and medical knowledge around its use. And so topically, orally, etc., it's really important to have an expert that is overseeing that. At least that's my position.
I agree with you. And one other thing to keep in mind is that much of the cannabis is grown with 18, 19, 20, 25 different types of pesticides and chemicals.
It can have mold.
And molds. And those toxins actually have an attraction to the fat layer in these plants. And so when you're taking the cannabis oil, the CBD oil, you are actually taking in a very concentrated amount of the pesticides as well. So you have to make sure that the cannabis or the CBD oil that you are using is of high quality, organic, and is not grown with pesticides or any other chemicals, and free of mold, right? So I think that's one of the big issues right now, is the toxicity of many of these oils available on the market. We have to be really careful. I also want to talk about my other favorite is PRP and
yes.
So for those of you who are not aware of what PRP is, PRP stands for platelet-rich plasma. And it has been used for a couple of decades now. Initially, it started in the orthopedic field of using the platelet-rich plasma from your own blood so the growth factors, and all the nutrients that are in the platelets, and injecting them into the joints to stimulate that collagen buildup, to help heal that fascia, the matrix, and to regenerate cartilage or tendons or ligaments or whatever may be inflamed or torn. And so initially it was used for that and still is being used for that. But later it moved into the dentistry field where they started using it in the bone after dental extractions or surgeries to get the tissue to heal much quicker. And they found that the results were much better with a lot less post-surgery problems. And then more recently has moved into the aesthetic field with injecting it into the face or for sexual health to stimulate the body's own mechanisms and collagen buildup in all the areas of the body. So it is a pretty profound treatment where we are using your own blood. We tend to go beyond just the regular PRP in that, number one, we check to make sure that your blood is healthy and not acidic. We want alkaline blood. We want high growth factors. We want good platelets in your blood. And so I typically put you on a very specific diet for at least a week or 2 weeks to shift that alkalinity in your system and to increase the platelet growth factors in your blood so that we get the results that we want. We use it for hair growth. We've had fantastic hair growth with it. But along with that, oftentimes, like we alluded to earlier, there's these chronic infections that can linger in our blood and can create toxins. And these toxins can land in different areas and promote inflammation, like in your joints or back or what have you. And so oftentimes I take the PRP and I mix it with ozone because ozone has this capacity to be a disinfectant. So it kills off the infections, but at the same time, it's stimulating even more growth factor and basically giving you a much better quality blood that's less inflamed to inject back into wherever we may be injecting you. The ozone also acts as an immediate painkiller, so it's a very profound analgesic. And oftentimes we inject these into the tissues to shut down the pain, along with neurotherapy to help the fascia heal itself, to let cartilage regenerate, ligaments to heal, get your little face lift, things are sagging.
Sign me up.
Huh?
Nothing. I said sign me up, but I'm good actually for a while.
Right.
For now.
And that's the thing. It comes from the inside, right? So if we're eating a very good diet, we're exercising, hydration. Cannot forget about hydration because that matrix is just filled with fluid, with water. That fascia is all water. In fact,
Yes.
it's like this network, like the cobweb of a spider is all water.
Yeah.
And so when we are dehydrated, we're going to have more pain, right? And we're going to start sagging more.
Yes.
Right? So drinking clean water that's filtered and free of heavy metals and chemicals and medications and all of that is really important for pain relief. It's huge. I think majority of people, if they just drank water with good minerals,
It's true.
they wouldn't have the pain.
Yeah, it's true. And it's really great to work with a physician that can look at some of these pieces and identify what are the most contributing factors. And if you're going to move towards an injection technique, work with that individual to have the appropriate diet and exercise and lifestyle modifications to make sure that that treatment lasts, because it's an investment. It's not always that cheap, and sometimes insurance doesn't cover it. So if you want it to be as effective as possible, you want to have a appropriate diet and appropriate modifications to make the treatment last. So I think that that's really a benefit of seeing somebody that will look at the whole you instead of just this ligament that is damaged or this joint that is damaged and so forth.
So definitely, there was a question about plantar fasciitis.
Oh.
So again, that fascia on the bottom of our feet, that for many people it can get inflamed and can be very, very painful where they have hard time walking. If you think about gravity, gravity pulls everything down. So if your body's toxic, whether it's with chemicals, pesticides, foods that you're not supposed to be eating, or infections, toxins from infections themselves, everything will pull, hormones, everything will pull down towards the feet.
Yeah.
And that's where the fascia gets the most inflammation, is in the feet as a result. So we have a couple of tricks. One of the things that we do is do an Ionic foot bath, which is basically using Iontophoresis. And on Iontophoresis is the science of using charged water, electrical charged water, to pull the opposite charge out of your pores in your feet. And so we charge up the water positively, and it pulls all the negative electrons and toxins out, and then we charge it negatively, and it pulls all the positive toxins out. And it tends to work beautifully. If that doesn't work, then we start injecting you. But along with the good diet and nutrition, lifestyle, like Dr. Marion was talking about, it is really important to make sure you're doing all of that good stuff in your life styles, getting enough sleep, drink water, breathe, right?
That's all you need.
I mean, that's all we really need. We have everything right in here. We don't need anything extra.
Yeah.
But the problem is that we often overuse some of these systems or underuse them, right?
Yeah.
Or we intervene. We play with nature, and we intervene, do surgeries, or take medications that are really not necessarily necessary. And we're playing with our physics. And then we start getting pains and aches and headaches and back pain and this and that, and we wonder why, right? So going back to the basics, I mean, that breathing is so vital, because not just because of the oxygen and the carbon dioxide exchange that allows the body to become more alkaline, but also because of the natural pumping action that happens with the lymphatic system, with the blood vessels, with the fascia, every time we're breathing in and out. And as we do that, things start moving. Our body likes movement. So that's why exercise is so vital. And Dr. Marion here is a professional skier. She's very humble, but she is a professional skier. She used to be. And she's always in the mountains. If you ever want to find her, she's up in the mountains, moving.
It's true.
Pumping that lymphatic system, pumping the circulation, pumping the heart. And as a result, she looks and feels so amazing, and her brain works so incredibly well. So it makes a big difference.
It's the altitude. It's the clean air up there. Thank you. That's really kind of you. And I'm bashful, but I do 100% eat, live, breathe this medicine, and part of this medicine is moving your body and being in nature, and that is in my core more than anything else in my life. So I do spend a lot of time out in the mountains, and with the fresh air. I think I just wanted to mention with foot and heel pain, a very little known cause of it can be something called Bartonella, a Bartonella infection, Bartonella henselae. And that's known as a stealth infection because it's very often misdiagnosed or not diagnosed. And that can be true of a lot of chronic infections and a lot of physical body pain. And this is a passion of mine because this is what leads to chronic pain and autoimmune diseases. And I really like to look at these bugs and chase after them and help the body fight them, and really reveal some of these root underlying mysterious, but then they become not so mysterious causes. And Bartonella is actually in about 60% of United States pets. So cats, dogs, whatever other animal, gerbils, I guess. So it's really much more prevalent, much more common than I think is understood. some people can be a carrier and be exposed and be infected and not exhibit any symptoms, and some people can have quite severe symptoms to the point of debilitating rheumatoid arthritis. So it's important to work with someone that looks at these infections that are not as well known, that are not as accepted in some circles of medicine. And
Exactly.
that's my soapbox for that.
Well, and it's a hard one to treat, right?
Yeah.
Because it tends to hide, along with the other common ones, chlamydia pneumonia, and that's not the STD. It's you can get it from a respiratory or a mosquito or a tick, and other people, and it can be passed on generationally. So if somebody, your mother, your grandfather, somebody had it, it can get passed on, and that's maybe 90% of the time is hidden in the plaques that they find in heart disease. So how many people in this country have heart attacks and some kind of a atherosclerosis, plaque buildup in their arteries? Millions, right? Maybe even billions. Millions of people have, at least not if themselves, but ancestrally, somebody in their generations behind them have had these heart issues, and it's most likely that there is an infection that is getting passed on to us, and it can harbor in the tissues like your back, your joint, and it can cause inflammation, swelling, and pain. And so that, again, that needs to be addressed. And sometimes it can start with a respiratory infection, like a bronchitis or a sinus infection, and we take antibiotics, and it's not really addressing the root of this infection. It goes into hiding, right? There's so much to talk about all of this stuff, Marianne.
Maybe we need a whole separate day for stealth infections.
Yeah, we need to.
I would love that.
Well, it's been a joy talking with you, Dr.
Yes.
Marianne. Any final thoughts before we take off?
Oh, well, just that this is truly a passion of mine, and I think of most naturopathic doctors, because sometimes there's limitations to conventional modern medicine, and looking closer at what could be contributing and what sort of safe therapies can be used to resolve the pain is really important. So it's a joy to talk about.
It is. Thank you so much for sharing this time with me, and thank you
all
of you for taking the time to have this conversation, and we look forward to another one next Thursday at noon at Holistic Naturopathic Medical Center on my Instagram site, drdarvish.nd, and we'll be talking about hormones and the connection with everything else that's going on. So look forward to talking with you next week.
Yay.
And stay safe and healthy. Take care.
Yay.
Bye.
Bye.
Bye-bye.
Thank you.